Hello, my name is Martin Kerrigan. Today I'm going to talk about traumatic brain injury, also known as the silent epidemic, and why it is something that we need to be aware of and think about when dealing with school children. So, according to the Individuals with Disabilities Education Act, traumatic brain injury is an acquired injury to the brain caused by an external physical force, resulting in total or partial functional disability or psychosocial impairment, or both of these, that adversely affect a child's educational performance. The definition goes on to say that it applies to all open or closed head injuries that result in impairments in one or more areas, such as cognition, language, memory, attention, reasoning, abstract thinking, judgment, problem solving, sensory, perceptual, and motor abilities, psychosocial behavior, physical functions, information processing, and speech. The term does not apply to brain injuries that are congenital or degenerative or to brain injuries induced by birth trauma. Those types of brain injuries, also known as acquired brain injuries, are usually covered under other categories of disability, mainly developmentally disabled. Okay, so the causes of pediatric traumatic brain injury are varied and appear to differ by age. Falls and assault, such as shaken baby syndrome or other physical abuse, are the most common mechanisms of brain injury in infants, toddlers, and preschoolers. TBI secondary to velocity injuries, which are motor vehicle, bicycle accidents, sports injuries, seem to occur more often in elementary school children and adolescents. So, if I look at this data here, the CDC estimates that there's over 800,000 traumatic brain injuries in children in the United States. Now, of those 800,000, or 837,000, over 812 are seen in emergency departments, over 23,000 are hospitalized, and over 2,500 die. While the number of deaths are decreasing, the incidence of brain injury in children is increasing. And what we have found is the groups that have the highest rates are 0 to 4 years old, older adolescents, those that are aged 15 and 19, and then adults 65 years and older. In recent years, that last group, adults 65 years and older, have become the highest demographic to incur brain injuries. However, and that's due to falls mainly. However, the second two most frequently occurring groups are those individuals 0 to 4 and individuals aged 15 to 19. And for children from birth through the age of 14, there's almost 500,000 emergency department visits for brain injury made every year. So, as stated in the title, brain injury is known as a silent epidemic. Brain injury is the most common cause of death and disability in children and adults up to age 45. A brain injury occurs every 15 seconds on average. There are approximately 5 million Americans who are living with the result of a disability, as a result of traumatic brain injury. And it is estimated that 1 out of 500 children and adolescents will survive a traumatic brain injury that requires hospitalization. So, TBI is considered to be a low incidence disability. TBI, however, it is still its own category under the federal law that ensures appropriate services for students with disabilities. And that federal law is the Individuals with Disabilities Education Act, also known as IDEA. In 2015-16, the United States Department of Education Center for Educational Statistics reported that there was approximately 27,000 students receiving services nationwide with the identification of traumatic brain injury. This pales in comparison to the over 830,000 estimated occurrences of traumatic brain injury that happen every single year. Okay, so this quote, and I'm going to read this. The hospital-reported incidence of mild head injury among children indicates a prevalence of 2 to 3% in high school-aged adolescents, Yet our survey of 616 high school adolescents suggests that light and mild head injury, which are brain injuries that don't necessarily lead to hospital admission, is almost 10 times that level. Despite the common notion that those types of injuries are generally benign, they found a significant relationship between reported head injury and hyperactivity, stuttering, mixed-handedness, and a dislike of mathematics. What is significant about this is that this article and this research was done in 1991. Awareness of brain injury has increased significantly since then. So in theory, more people and professionals should be aware. And actually, also, the prevalence data should also be increasing. So what does it look like in Maryland? In 2014 alone, there were 367 hospitalizations in the state of Maryland where the patient was between birth and 18 years old and the primary diagnosis was traumatic brain injury. Now, this does not take into account that 367 are only those that were admitted to a hospital. This does not take into consideration those students or those individuals that were seen by their primary care physician, at a walk-in medical center, or who were seen but not admitted to the hospital, or who never received any medical attention at all. And those 367 students are more likely on the moderate and severe end of the spectrum in that they were admitted to a hospital with a primary diagnosis of traumatic brain injury. Continuing on to what this looks like in our schools. So according to the most recent child find data, which is the census that Maryland State Department of Education puts out every year, there are currently 221 students statewide receiving special education services with a disability identification of traumatic brain injury. There's an additional 6 students who are being served at the Maryland School for the Blind, in addition to the 215 in our public schools. This adds up to a total of 221 students statewide that receive special education services as a result of traumatic brain injury. And that is 0.21% of the total amount of students receiving special ed. So using the occurrence rate of 365 instances a year, and if you cover 18 years, which is from birth through the age of 18, you end up with a total of 6,570 traumatic brain injuries requiring hospitalizations. There's a big difference between 6,500 and 221. So according to this data, of all the students, of all the school-age children that are hospitalized with a diagnosis of traumatic brain injury, only 3.3% result in the onset of an educational disability. Now, I'm not saying that all brain injuries, and I'm not even saying that all brain injuries resulting in hospitalization are going to result in the onset of a disability, but it is most likely greater than 3.3%. We also do not have data on how many students are being served through a 504 plan, but based on the IEP data, there is reason to believe that those numbers are going to be well below the occurrence as well. So the numbers don't add up. The CDC estimates brain injury prevalence to be 10%. There are approximately 1.3 million school-age children in Maryland. That means there's 130,000 kids with brain injuries. So let's just say 5% of that 130,000 suffer the onset of a disability related to a traumatic brain injury. That comes out to 6,500 individuals with a disability as a result of a brain injury. Yet we are only serving 221 students statewide. Again, while not every brain injury results in the onset of an educational disability, it is most likely significantly more than 221 out of 130,000. And these numbers are being conservative. Why should we care? How does this impact me as a professional in the school? So even though a student with a brain injury may exhibit behaviors and characteristics that mirror other disabilities, it is still essential that they are properly identified. Proper identification leads to more effective interventions and services that are appropriate. Many times, traumatic brain injury ends up being misidentified as emotional disturbance. Now, many times interventions that you would use for a student with brain injury are going to be the same that you use for other students, but the way they are delivered is what is different. Brain injury often is a later onset condition rather than one that is developmental. So what can be done? Communication, communication, communication. Collaboration. The family and student should be an integral part of the team. Communication and collaboration among all the different entities and professionals that work with the student is essential to ensure that students are properly identified and receive the appropriate services. The family and the student should always be at the center of the discussions and the focus of this collaboration. They should also be involved as much as possible and to the fullest extent possible. This communication should go between all entities that come into contact with the child. And this includes, but is not limited to hospitals, schools, school nurses and health teams, pediatricians and other medical professionals, coaches, teachers, school counselors, and as stated before, most importantly, the family. If the communication improves, then there's a higher likelihood that these students will be correctly identified. Another key component are school psychologists and guidance counselors. They oftentimes serve as gatekeepers into the system. And when I say system, I'm referring to services such as special education and 504 plans. Guidance counselors and school psychologists should be asking the questions and seeking whether or not brain injury plays a part in the difficulties that the children may be encountering. And again, I cannot emphasize enough the importance of keeping the family and the individual in the center of the discussion. So, best practices. Brain injury should be explored anytime there's a concern with the student. This includes, but is not limited to, at screening meetings, at child find meetings, at kid talk meetings, at IEP, which is individualized education plan meetings, at 504 plan meetings, anytime there's a functional behavior assessment or a behavior intervention plan that is being implemented, parent-teacher conferences, during vision and hearing screenings. Oftentimes, parents are going to be the most accurate source of a child's medical history. This can be tricky, especially when asking a parent or guardian to disclose a head injury. They may be hesitant to report such occurrences since they may think it is a reflection on them, or out of fear of being accused of abuse, neglect, and so on. So how do you ask a parent about if their child has had a brain injury, or if there's a history of brain injury? You can also ask these questions of the student themselves. Has your child ever had a concussion? Has your child ever hit their head and lost consciousness, even if only for a short time? Has your child ever received medical attention as a result of hitting their head? Has your child ever hit their head and had a headache that lasted more than a couple of hours? Has your child ever hit their head and had difficulty with thinking, emotions, or behavior, even if only for a little while? If there is an answer of yes to any of these questions, then it makes sense to probe deeper. It also might make sense to ask the child these questions in certain situations, since their parents may be unaware. They may also be afraid to answer honestly for a variety of reasons, including fear of retribution for being a bad or neglectful parent. Things for you to remember. Traumatic brain injury is underdiagnosed and underreported, especially in schools. Academic, behavioral, and emotional difficulties are all common consequences of traumatic brain injury. There have been several different studies that have looked at prisoner populations and co-occurring traumatic brain injuries, and the numbers are staggering. These individuals had their brain injuries and most likely never received the appropriate treatment or services. If we can catch them early, we can prevent a lot of these things. So for things for us to remember as professionals, traumatic brain injury is underdiagnosed and underreported, especially in schools. Academic, behavioral, and emotional difficulties are all common consequences of a traumatic brain injury. All traumatic brain injuries do not result in loss of consciousness. A concussion is a brain injury. These difficulties do not have to be permanent and many times can be dealt with by teaching compensatory strategies. It's also worth noting that the behavioral and emotional difficulties piece is a significant component of brain injury. Many times, these individuals with brain injuries are not served appropriately. It presents as emotional disturbance, and it ends up leading to being labeled that, coded that, and then falling into that stigma. One study looked at inmate population in a Midwest state and found that over 90% of the individuals that were on death row had had a documented history of traumatic brain injury. If we are addressing brain injury and providing appropriate interventions and services at an earlier age, we can hopefully reduce some of that number. So, there are simple tools that can be used to help. The HELPS is one of several quick screening tools that is available. These tools should not be used as an official diagnosis or diagnostic tool, but instead should be used to help explore the possibility of a brain injury. Positive responses on the HELPS should lead to follow-up with medical professionals who are the ones who should be doing the diagnosing. The impact of a brain injury may not become evident for months or sometimes even years after the injury. This is especially true in the developing brain of a child. When you look at brain development, a child may have had an injury when they were younger, didn't really start to show itself until they hit puberty when the frontal lobe develops. That was the part of the brain that was impacted, and the child ends up being identified as something other than brain injured because the brain injury is never even considered, or the hit to their head was never even considered. If students with brain injuries are not properly identified, they most likely will not be served appropriately. However, if served appropriately, then most likely the outcomes will improve. It is likely that their students are not being served appropriately because they have not been properly identified as having traumatic brain injury. It's also our job as professionals in the school system to educate parents and other professionals about traumatic brain injury and its frequency. Parents and guardians may be hesitant to report a traumatic brain injury or may not see a correlation between a past traumatic brain injury and current school difficulties. Ask about possible history of a traumatic brain injury in children. Traumatic brain injury is an epidemic. This statistic that was found from 2004. Traumatic brain injury is present in 85% of traumatically injured children, either alone or with other injuries. We need to keep this in consideration. Anytime a child is involved in some kind of accident, assault, injury, etc., the possibility of a brain injury should be explored as well. One last closing statement. Traumatic brain injury. Ask about it. Thank you.